Hello all, good morning. Thank you so much for joining this program. I welcome you all for the soft launch of AHCN, Applied Holistic and Clinical Nutrition Program. Thank you so much for choosing this program. So the agenda of the program, I can say like the key highlight of the program is to tell you why this program and what you can expect from this program. So before I go into the main agenda, I would like to introduce myself because there are a lot of people who are from non-HMTP background. So myself, Revathi Prasad, I've done my MPhil in food and nutrition and been practicing since 15 years in Chennai and started my private practice under my brand name Revathi's Diet and Destiny since June 2021. So this 1.5 years of experience has given me a lot of knowledge, which I would really love to share with you all. And along with me, I'm doing this session with the collaboration with the HMTP, that is Holistic Nutrition Training Program. It is run by Dr. Suresh Kumar, mentor. And so he is the one who gave me the confidence of coming up with such a program. So thank you so much, sir. So I am grateful to him. So now get into the main agenda of the program. So why this program? So any initiative for that matter, there is always a story behind it, right? So my story, I'm damn sure that my story is going to be a story of every dietitian who can really relate well. So my story is like when I started practicing as a dietitian, my practice started in a hospital, very well reputed hospital in Chennai, and I have a lot of dreams because becoming a dietitian was my passion, and so I want to actually get into the hospital. You know, wearing that white coat was like really a pride thing. So any dietitian would really love to wear that white coat, right? So we always feel very proud wearing that. So with lot of dream, I started my career, but I mean the expected support wasn't happening. There were senior dietitians and in the hospital, and I was expecting a lot of guidance from them, but that wasn't happening much. Lot of communication gap, and I hardly had any support. And above all, whatever I studied in my college, when I was trying to put it into practice, it was like really a challenging one because there was a lot of differences in terms of reading something in your from your textbook and putting it into the practice. So there was a lot of lag. So I felt really disappointed, and in a way that I even felt that isn't my piece of cake or not. And so slowly it also eventually happened after I quit from that hospital. I joined various organizations. Even there, I hardly had senior people to guide me. So wherever I joined, it was like me who has to really learn from the scratch. I need to experiment a lot of things, and I need to fall and rise on my own. So it was very, very difficult for me, very challenging for me to get the results expected. And so slowly, once I started gaining some experience, I really felt like I need to share my knowledge to those dietitians who are really want to do something to the community. And so I felt like I need to come up with a proper program. So I was just waiting. This is a dream come true for me. It's a uh, very big dream of mine which has come true. And thank you so much for being part of my dream come true. And so this is one thing which really made me think of this program. And another one is like a lot of clients expectations. See, every client know, every person know what is healthy eating, how they can benefit from healthy eating, healthy lifestyle. But the problem is like why are not they able to follow it? So it is very, very common that every dietitian would have experienced. We try to give the best of solution for our clients, the patients, but they don't follow, and they end up saying that, oh, this dietitian, she is not that good, she's not good enough. Now, those kind of recognition is very common, and that really concerned me a lot. You know, being a dietitian, we all know that how much we put in our effort, but it is if it is not recognized, that's a different story. But it is being put under the other way around, saying that she's not good enough. So all these things really made me think of coming up with a program proper structure. So this is the story behind it. And the second thing is like I experienced a lot of confidence the moment I started practicing as a private practitioner. And I stopped doing the single consultation. And after joining HNTP, this gave me the confidence of taking client as a, I know they need to enroll them with me as a program. So it is a 3 months program where I was able to have follow up calls, which really helped me to connect with the client much more better. And it really helped me to develop the rapport with them and started getting more information from them. And this is something really helped me a lot. And the third thing is like it is always a long gap between the college studies and the things putting into the practice. So everything put up together, I really want to do something for the dietitian community. So I thought, why not come up with such a program? So next is what you can expect from the program. So before I go on to that, I would like to share uh, two client experience. Though I have a lot of client experience, but these two are like very, very close to my heart, and that is, I can say, one of the reason for coming up with such a program. So, collecting medical history is how important it is in terms of getting the desired result. So, um, this client who came to me was suffering with CKD, that is chronic kidney disease, stage 3. And he's been suffering it with since past 4 years. And he came to me. And when I was taking the medical history, I know that he is a known case of hypertension. And when I was asking for the medication, he gave me one medication, which is actually a OHA, that is oral hypoglycemic drug. I asked him, "Are you a diabetic?" He don't know. Then I asked him, "Why are you taking this medication?" Then he told me that, no, Revathi, this was prescribed by the doctor saying that this is a trial medicine for CKD. So I've been taking it. This person is from US and very well educated, and he gave me such an answer. So I was like quite surprised and shocked, like why he's taking this medication when he's not at all having any sugars. Then I told him, okay, let's do something. Let's stop this medication for a while if possible, and then do the blood test. So he was due for his blood test, regular blood test every 6 months once he does, and he was due for that. So what he did, he stopped the medication for 3 days just before the blood test, and he did the test, and the results were like really surprising and shocking. The kidney function improved tremendously, and he was like really shocked. He was telling like, really, you know what to do. Then I told him, "Sir, you have to get the guidance from the doctor. The case is still on, and you will get the detailed version of the story in the case study in the program." Why I am sharing this is like we sometimes try to overlook certain things when it comes to medication, or it could be the medical history. So whenever you are going to ask certain things, try to collect maximum information so that we don't miss anything when it comes to a client's health condition. Now, the second case is like again very close to my heart. So, Dr. Suresh Kumar, our mentor, always used to tell us that every client is a teacher to you. They come to you in your life to teach you something. And this client, she's an unmarried girl who came with a complaint of PCOD, and she's been suffering with it past 6 to 7 years. And she came to me for the help. So, as I said, I don't do the single consultation. So slowly in the follow-up call, she revealed that she's a sexually active person. So what happened is, being a coach, you have to be non-judgmental, and this client really helped me achieve that. She made me evolve like a holistic coach, and I'm from a very orthodox family where I had a strong belief system that certain things has to be this way only. And this client, she broke that for me. And I started talking to her. I asked her, like, imagine if your life is being you've been married, first marriage, your husband died, and you get married to a second person, and that person is not of good character. You don't have a compatibility, so you divorce him and you just again get married to the third person. Now you tell me, will you still hold the guilt of having physical relationship with so many men? No, right? So I told her, like, you have to release that guilt. You have to start loving your body, because she was like completely having that guilt and she don't want to even love herself. And then I asked her only one question. So it is all about the perception. If it is married, then you can have a number of physical relationship. Is that okay? And if you are unmarried, you are not. So it is all about the perception, how you see. And this girl started thinking, and I told her only one thing. So listen, so you want to be a victim or victorious, and you want to really inspire the world with the story that yes, I experienced all these things, but still I'm happy today, living my life completely. So this really changed her perception, and she started menstruating without any medications. Again, the detailed version of the story is there inside the program. So, what I would really try to tell you is, it is not about how to do the assessment or how to do the counseling, but how to put it into practice. So, you all get these things in this program. So, to summarize, what you can expect is data of it. So, this will include, the program will include the assessment part, the family history, the medical history, the demography, and then coming to the nutritional assessment, and then talking in terms of a specific health condition. What are the blood parameters you need to really understand? How to interpret all these things, and so how to counsel. So all these things will be there in this program. This is one. And second thing is, like, it is not only going to stop with here, but I'm going to share my case studies, how with my practice I was able to really change the outcome of the results, and how you can actually practically implement it in your cases. And then there will be live discussions happening every week. So this is all you can expect from the program. And these live sessions are going to be on Wednesday between 1 to 2, because most of the dietitians are practicing. So I felt like the lunch hour should be you know uh, convenient for everybody. So 1 to 2 is the timing for live sessions Wednesdays. And you will have a support group, so you are all there, whoever has enrolled. And so you will have a support group where we will be hand holding each other, and we'll be evolving as a strong dietitian community, strong coaches community. And so you will be getting the access for the complete lessons, the lessons from 15th onwards. And the lessons are going to be on Kajabi app. And for people who are from non-HMTP background, I will share the details of the Kajabi app, so you can just keep it downloaded it. And one request is, please make sure that you all filled your form, because we need your Gmail, I mean your mail ID, to give the access to the program. And you will be getting the mail with login credentials, and with which you will be able to sign in with the program. So this is it from my end. So any questions, I'm open for it. So silent. Am I so clear?
Yeah, Revathi, how many videos?
Hi, Revathi.
Yeah, hi. Who's this? Shubhi, you want to say something?
Yeah. How many videos I asked? How many classes are there?
Okay, so what I will do is, like, I will just give you the complete content of it in the form of a YouTube link. So I have just posted it I've uploaded in the YouTube and shared the link with you all. What exactly you're going to learn from this program. So basically, I've planned 8 modules, under which there are again a lot of subtopics under that. So 8 modules are, as of now, it is being planned. Yeah, you do get certificate.
Revathi ma'am, what is the validity of this Kajabi app? How long can we access the modules?
Right. So Neelam, it will be like from the date, it will be like 180 days. So you get the access for 6 months to access the complete lessons.
And do we get some assignments for that? Say, for example, for certification, do we need to submit some assignments or something?
Not really, nothing as of now planned. So it is all about like sharing my knowledge, and actually, we are going to have give and take policies. So it is all about how you are going to implement. See, basically, this program is going to give people a base, like how to go about with the assessment, how to interpret, what you really need to understand. See, what generally happens is, what I understood is, we always try to manage the disease, but as HNTP, from HNTP background, we all know that there is always a triggering cause which we most of the time fail to address. Okay, so this example I've used even in almost 2-3 modules. See, if a water is boiling, okay, and you want to get down the temperature of the boiling water, we have two options to do it. One is putting off the flame, so permanently the boiling temperature comes down, or you add some cold water to it. But pathetically, unfortunately, most of the time we try to add the cold water and to stop the boiling for a temporary time. And again, even the cold water is going to change, and it is also going to start boiling. So until we don't put off the flame, we are not going to get the desired results. So this program will give you the maximum reasons, or the maximum factors that which is triggering any condition, so that you can start relating with clients. So if every client is a different book, so they come to you with all different possible reasons, but we as a professionals, we need to help them understand what really triggered that. So basically, it is going to be like the clinical aspect, and coming to the holistic aspect, you will be able to understand the emotions, how the emotions are like actually getting into the physical body and manifesting as a health condition. Even that connection will be addressed, because nowadays any health condition, definitely doctors, any medical professionals use this tagline called stress. And stress, it is of million types, and we need to really understand that we need to address the stress. Only then whatever the diet plan you're going to give to the client, it is going to work, and it is going to give you the desired results, the optimum results. So this is what you can expect from the program.
Hi, Revathi. Revathi, is it going to be like one module per week kind of a structure, or is it going to be like all the 8 modules would be live and we can access it at our own pace? What is there in your mind for that?
Richa, basically the videos will be like ranging from some 15 minutes to 30 minutes or 35 minutes. This is what I have planned for each video. And you can easily watch these videos within a time frame. So 6 live sessions, you will be able to finish off the complete videos, I mean the complete modules. That's how I have planned. So still you have doubt, post that 6 weeks, you can always post the questions in the Kajabi. It is similar to our HNTP only. You post it, then we can actually connect in the group, or we can again connect if required. Then lot of questions, then we can do a Zoom also again. But as of now, plan only 6 live sessions, Richa.
Okay. Okay. So, like just as you said that there are going to be 8 modules. So the discussions of the live sessions are going to be module wise, or is it like wherever we are in the program, we can ask the question from there?
Wherever. That's the reason fixed with 6. And so you can actually come up with any questions wherever you are, and that will be answered. It will be, most of like discussion type, and whatever I know, I'm going to just share it with you, and you can share it with me. See, again, I'm telling you, this is going to be a base for anybody who wants to start practicing individually, or in a hospital setup, whatever it is. This is going to be a base, and definitely these questions will be answered in the live sessions. It will be more of discussions.
Wonderful. Thank you so much. And one more doubt, Revathi, the modules you have divided like disease wise, or how have you structured the modules?
See, first 4 modules will not be very specific thing. It is more of focusing on kind of the assessment part, the demography, why you need to ask such questions, what you need to interpret from that. So these are the things you will be learning, and after which the 4 modules will be on disease specific. The 4 modules will include like the blood parameters, how you need to interpret. The second thing will be the dietary intervention, and third thing will be the case studies. Fourth will be the live discussions. So everything is going to be on disease thing except for the live.
Okay, great. Thank you so much.
Hi Revathi, I just want to know, do we get the recording of live discussion also that you set on Wednesday 1 to 2, as I am
Yes.
unable to?
Yes, definitely. Yes, you will be getting it, the recorded version on the app.
Okay, thank you. As I am working as a school teacher, so it's not possible for me. That's why I asked. Thank you.
Right. Yeah. You get all the recordings actually. That will be done under the bonus section.
Hi, morning.
Hi,
Revathi.
madam. This is Dr. Mark.
Hi. Hello, ma'am. Yes, ma'am.
How do you download the app? Because I have no idea how to do that.
Yes, ma'am. I will just get in touch with you in person, ma'am. I know there are few people who are from outside.
Not part, because I'm not part of the group and it's new to me, so you just have to guide me through this.
Yes, ma'am. Definitely, I'm there. I'll call you, ma'am. Once
Thank you.
the access is started, I will call you in person and let you know how to use the app, ma'am.
Thank you so much and best wishes to all of you.
Thank you, ma'am.
Hi, Dr. Ma'am. This is Dr. Mark.
Hello, sir. Thank you so much for joining. Yes, sir.
All the best to you, Revathi ji. All the modules is being done by you, or it's a team effort, or who are going to be involved in this?
No, I don't get your question, sir.
Is my voice clear?
Yes, sir, but it little, I guess you are on speaker. Okay. Yes, sir, please proceed. I'll just try to understand.
Sorry to disturb, Revathi. Sir is asking, you are the one who did all the videos or someone is involved in this?
Oh, okay. No, it's me, sir. As of now, it's only me. Just trying to get some help from Neelam also. As of now, it's only me who've done the videos. See there? He disappeared. Okay. So, any other questions? So, since the Zoom is going to get over in 8 minutes.
Just a generic question everybody would have in mind. How different is it from the hospital learning? Like we go for internship and all, but how is it different here?
See, when you go to internship, it is not that there will be a structured pattern of questioning a client or a patient and how you assess, how you interpret. These details won't be there. Of course, we've been taught a basic assessment, but from there, how you need to proceed further, how you need to really handle that case, what are the different aspects of it to learn it in depth, so that you are able to really customize the intervention, really customize understanding your client, and then giving the intervention brings a lot of changes, Neelam. In hospital setup, I don't think it is possible, but here it will be like each and every client who is coming to you will be like a very unique person, and you will also be able to give a unique service to that person. So I can guarantee that aspect of it. I mean, that's the difference I can say.
Ma'am, how many case studies will we discuss?
Rekha, as of now, planned 7 case studies, Rekha.
Okay, ma'am.
Anything else?
That's it.
Just looking forward now.
Thank you so much, Neelam. Fine. So, shall we call off for the day? Are we done?
Yes, ma'am. Thank you so much. We are so excited.
Thank you. Thank you so
Thank
much.
you,
looking
Revathi.
forward.
Looking forward to the program. Thank you so much.
Thank you.
Revathi ma'am, there are a few questions if you can answer.
Yeah.
Shabha asking if there will be any MCQ quiz exam once we complete the program. I guess you said no to that, right?
Yes, there is no assessment as of now. So no assessment plan. So certificate will be provided, provided that all the modules been completed, and at the end of 6 months, you will receive the certificate. See, for me personally, more than the certificate, how much knowledge are we going to really gain? That matters a lot. Certificate isn't just a piece of paper, but imagine your client coming and saying to you like, ma'am, I'm so happy that I really chose you for my health. I feel that is the highest certificate any dietitian can really work for, right?
Client transformation is the biggest certificate. है ना रेवती ma'am?
Definitely, sir. Definitely. So,
Ma'am, if we are suppose once we go through the modules and we are having doubts, are we supposed to discuss only in the live, or can we discuss it with you in person also?
Rekha, there are so many channels. Yes, Rekha. See, the thing is like, you can post the question in the video itself. Below that, you will have the comment section, so you can post your question over there. One. Second thing, you can put it on the WhatsApp. Third thing is like the live discussion. When we have the live, we can discuss it over there also.
Okay, ma'am.
So yes, done.
Yes.
Okay. So thank you so much for all your time, and thank you so much for choosing this program. So looking forward, really excited, and hope the knowledge, whatever I share, it is not only mine. It is definitely a lot of reference from the Holistic Nutrition Training Program 1, and second, not the least, the experience and the knowledge shared by my fellow coaches also. So looking forward to give it everything in a capsule form, so that it is like a ready reckoner for all your practice. Thank you so much for being here. Looking forward.